Hello and welcome to the instructional video of the supraperiosteal anesthetic technique. The practitioner or the administrator must be in proper attire, such as wearing sterile gloves, a face mask, a head cap, and, most importantly, a white lab gown. The patient's position is very important. The patient must always feel very comfortable because the procedure may take a while. The patient must be in supine position to reduce syncope. The complete apparatus for this procedure are the following. Outside the enamel tray are your unsterilized things such as your cotton dispenser and waste receiver, including 2 dappen dishes for your antiseptic and for your anesthetic or topical anesthetic, such as the topical gel. On the other hand, inside the enamel tray should be the sterilized instruments. As I repeat, only sterilized instruments should be inside the enamel tray, such as your basic instruments consisting of the mouth mirror, explorer, cotton pliers, and spoon-shaped excavator. Don't forget the most important instrument, your syringe. Also prepare sterile gauzes, swabs, a 27-gauge needle, long and short, and cartridges, and extra gloves. Always take precaution that the cartridges should be inside its sterile container, not until it is going to be used by the administrator. The patient's attire preferably would be not revealing clothes. He or she must be wearing a head cap, a bib to protect his or her clothes, and must be comfortably seated. Tissue preparation. Slightly retract and gently dry the tissue with a 2x2 gauze square carefully. The antiseptic should be applied to the area where the needle will be inserted, with the use of a cotton applicator or a cotton swab. After placing the antiseptic, a topical anesthetic should be applied to the same area where the needle will be inserted. This is to provide sufficient anesthesia to the soft tissue. Wait for 1 to 2 minutes for the topical anesthetic to take its effect before continuing with the dental procedure. Loading of the cartridge and testing the flow of the needle and syringe. We are using a breech loading, metallic cartridge type, aspirating syringe. Retract the piston fully before attempting to load the cartridge. Insert the cartridge while the piston is fully retracted into the syringe. Engage the harpoon while holding the syringe. If you're using a spiral harpoon, gently twist the harpoon on the silicone rubber plunger. Then retract a little to make sure that it is well engaged. Attach the 27-gauge short needle to the syringe by removing the white protective plastic on the cap of the syringe and of the needle and screw the needle into the syringe. Carefully remove the plastic protective cap from the opposite end of the needle and expel a few drops of the solution to test for the proper flow. Inserting the needle into the mucosa, aspiration and removal of the needle from the mucosa. Make sure that the bevel is properly oriented toward the bone for the supraperiosteal technique. Hold the syringe parallel with the long axis of tooth number 14. Insert the needle into the height of the mucobuccal fold above the apex of tooth number 14. Make sure to find the landmarks such as the mucobuccal fold, crown of the tooth, and the root of the tooth. Make sure that the depth of penetration of the needle is 1/3 into the soft tissue. Aspirate twice. If negative, deposit 1/3 of the cartridge slowly over 20 seconds. After depositing the anesthesia, carefully withdraw the syringe, and then keep the needle safe by using the scoop technique. Wait 3 to 5 minutes before the dental procedure is done. Recapping the needle using scoop technique. After removing the syringe from the patient's mouth, or after removing the needle from the mucosa of the patient, use the scoop technique without holding the cap to prevent any injuries with the needle that may cause danger to the administrator. The needle is now contaminated with saliva, blood, and debris. Always take caution when capping your needle or recapping your needle. Remember, use the scoop technique.